all, it's Dr. Ruth Doughton here. I'm a board-certified adult psychiatrist. Today I want to talk about a few of the lesser-known side effects of SSRIs. Now, SSRIs are our go-to antidepressants and they can be well tolerated by many, but there are a few adverse effects that can be potentially really severe and that patients are rarely informed about. So the first one is emotional blunting. And this is in some ways actually the intended consequence of the medication, right? It's going to decrease the intensity of your depression and your anxiety symptoms so that they're more manageable. But sometimes this works too well, meaning that people start to feel like they can't experience positive emotions or empathy or even the less pleasant emotions like they would normally or they would want to. This can often be mitigated by a dose reduction, but not always. The second one is post-SSRI sexual dysfunction. Now, patients are often counseled about the potential sexual side effects of things like decreased libido, difficulty achieving orgasm, etc., but they're under the pretense that these things will go away after the medication is discontinued. But there are rare cases where these symptoms do not discontinue. The syndrome tends to be associated with severe emotional blunting as well, and genital numbing is a particularly concerning symptom that could be a warning sign. Lastly, there is the risk of protracted withdrawal. This usually happens when someone's been taking the medication for a long time and then abruptly stops, but it is possible that someone could develop this even if they are using a relatively cautious tapering schedule, particularly in more vulnerable populations. Traits that might make someone more vulnerable would be being older, having a co-occurring neurologic or brain injury, longer exposure to the SSRI, and a personal history of withdrawal symptoms from trying to get off of psychiatric medications. This is a neurologic injury that can result in a series of different symptoms, including severe anxiety, insomnia, brain fog, dissociation, sensitivity to light and sound, numbness and tingling, tremors, balance issues, palpitations, GI upset, and akathisia, among others. So if you're interested in discontinuing an SSRI, it's important to take a conservative taper approach to decrease the risk of this happening. Well, at least the last two effects that I talked about are not very common. They do occur and can be potentially catastrophic for the people who suffer from them. So make sure to get all of the information and to ask all of your questions so you can get true informed consent. Wishing you all good mental health today, and I'll see you in the next one.